Thanksgiving holidays typically include family gatherings and lots of good food. So how can one be social, enjoy the food, and maintain some semblance of a reasonable diet and healthy lifestyle? Dr. David Winter from Baylor Scott and White Health joins us with some holiday health tips. Good morning to you, Dr. Winter.
Good morning, Cleo. Good to be with you.
Glad to have you. Okay, Dr. Winter, what are you telling your patients about eating over the holidays?
Yeah, I tell them to be reasonable and realistic. You know, maintaining the ideal diet during the holidays is probably not very practical. Still a good idea to have maybe smaller portions, maybe just a bite or two of that wonderful dessert that you want. That can make a difference. Now, if you want to actually burn up some calories, you need to have some activity. So what I'm also encouraging is get some walks going around the neighborhood, maybe some activities. My family's all coming in. We plan to have pickleball, croquet, beanbag toss, and walks around the neighborhood to try to balance out eating more and also burning some of those calories up.
All right. Now, how about drinking over the holidays? Do you have any suggestions regarding the alcohol intake?
Yeah, now that can be a challenge. You got peer pressure, you got anxiety, you might want to calm down. Here's one tip that can be kind to your liver. Every time you have a drink, then have a glass of water. So a beer, water before you get that second beer. Now, if you get some flack from your friends about that, just disguise it. Have ice and water, put a slice of lime in there. It looks like gin and tonic. Try to hide that from them. But I think cutting back on alcohol, or at least mixing it with water, will get you through the holidays much safer and much nicer to your liver.
Yeah, that's a good idea. Dr. Winter, you know, mental health is so important as well. Do you usually maybe see an increase in anxiety and depression around this time of the year?
Yeah, we certainly do. A lot of stress out there. You've got people coming in, preparations, planning for that, shopping, I mean, with all the crowds, plus the higher prices we may be seeing in some of the stores right now. One tip about shopping, get there early. When the stores open up, that's when the crowds are the less. You can get in and out a little bit quicker. And then there's depression. If you're prone to depression, be careful during the holidays. Try to get in touch with a friend, a colleague, family member that you can relate to, can talk to about this. Don't spend time by yourself. Holidays can be stressful, cause anxiety and depression. Please try to cope with that well during these holiday seasons.
Great advice. Dr. Winter, before we go here, we've heard that influenza cases are on the rise. Are you concerned that family gatherings will spike a surge?
Yeah, I'm very concerned about that. You know, we learned something last year. We saw practically 0 cases of influenza, and for that matter, hardly any common cold, RSV, all those airborne infections, they weren't around. So the things we did for COVID actually work. So being careful in indoor settings, distancing, washing our hands, these masks, yep, they still work. Also isolating and quarantining. I just had a couple in this morning. One of the couple is sick, coughing, sneezing. I said, we're going to try to figure out what you have, but I'm going to recommend that you either stay home or wear a mask when you're out with the family. Don't spread it to them. A lot of stuff out there right now, and in crowds, these viruses love to jump from one person to the next to the next. So have fun, but be safe this holiday season.
Great advice. Dr. Winter, thank you so much for joining us. Always a pleasure to have you.
Cleo, good to be with you. Happy Thanksgiving to you.